Laura is a 35-year-old female that comes into the office today with the chief complaint of being here because she is pregnant with a past medical history of depression requiring Lexapro and a miscarriage at 30 weeks pregnant 5 years ago requiring a DNC. The patient just moved here from Ohio where she was receiving prenatal care and states that she is 30 weeks pregnant. She's gravida 3, para 0. Her only symptoms include back pain that she feels is from her belly growing, and she is feeling more tired than usual. Both are worsened when she's standing all day, but is relieved with rest. Ms. Laura takes no current medications other than her over-the-counter prenatal vitamins, and the patient has no non-drug allergies. Review of systems. General, she has complained of weight gain from 155 to 167 pounds since being pregnant and feeling more fatigued. Denies edema, palpitations, chest pain. Denies any skin rashes. Denies a cough, shortness of breath, or congestion. Denies visual changes. Denies abdominal pain, nausea, vomiting, diarrhea. Denies hearing loss. Denies issues urinating or burning with urination. Patient is sexually active with the husband that does report having to urinate more frequently since being pregnant. Denies sinus problems, denies joint swelling, stiffness, or pain. Denies pain in breast lumps or breast changes. Denies weakness or dizziness. Denies heat and cold intolerance, and was tested for HIV at her first OB appointment in Ohio. Denies depression, anxiety, and sleeping problems at this time. Vital signs were unremarkable. She is healthy appearing adult, female, and is in no distress. She is alert, oriented, and answers questions appropriately. Head is normocephalic. Ears are patent bilaterally. Nose, the nares are patent. The teeth are intact but no dental caries. S1 and S2 are heard with a regular rate and rhythm. There's no extra sounds, murmurs. Capillary refills are less than 2 seconds. Pulses are 3+ throughout. No edema noted. Lung sounds are clear. Breasts are even and unlabored. The patient is pregnant, so the abdomen is rounded and firm. Bowel sounds are heard in all 4 quadrants. Breasts are non-tender and free of any masses. No skin discoloration. The bladder is not distended and non-tender on palpation. Speculum was used for pap and pelvic exam. The vulva appearance is normal and not tender. No lesions or masses. Vagina is within normal limits with no lesions noted. No bulging or straining. Normal vaginal mucosa. Cervix is pink with no discharge or lesions. Uterus is anterior midline, smooth and not enlarged. No adnexa felt. Full range of motion is seen in all 4 extremities. Speech is clear. Patient is awake, alert, and oriented. Lab tests, we're going to do a urinalysis to check for infection, pregnancy test to confirm the pregnancy, CBC to assess anemia and infection, type and screen to assess blood type and incompatibility, Hep B, syphilis, HIV to assess for positive results as they can affect the baby and the mother. Would need treatment. Glucose test to assess gestational diabetes. Differential diagnoses would be miscarriage, which is a loss of a baby typically around 20 weeks of pregnancy or before. Symptoms include abdominal pain, passing of large blood clots, or tissue and vaginal bleeding. Molar pregnancy, which is a fertilized egg that develops into a tumor instead of a baby. And then final diagnosis is 2nd trimester pregnancy. During the 2nd trimester, morning sickness subsides. There is an increase in breast tenderness. The female starts to gain more weight, and there's an increase in urinary frequency and constipation that can occur. Medications, patient is to continue to take her over-the-counter prenatal vitamins. Safe medications to take for low back pain include Tylenol, and the patient can take Colace for constipation. Non-pharmacological recommendations, she needs to remain active to decrease the pain and increase bowel motility, but has to remember to take periods of rest. Diagnostic tests and ultrasound to assess for fetal development. Patient education, educate the patient on safe medications that can be taken while pregnant. Cultural considerations would be birthing plan options. There are many things that women can choose to do or not to do and are technically not the norm. Health promotion would be to screen for depression, as the patient does have a history of depression. Give a referral to the OBGYN, and for the patient to follow up in the office 4 to 6 weeks at the primary care office.